the midst of the COVID-19 pandemic, with the initiative from the Department of Science and Technology, the Philippine Council for Health Research and Development, or PCHRD, has expanded the dengue and other arboviruses program to form the Re-emerging and Emerging Diseases Program, otherwise known as RED. Emerging and re-emerging diseases continue to pose serious and alarming threats to public health globally. Emerging diseases are diseases that have recently emerged in a population or those that are rapidly increasing in incidence or geographic range, such as Zika virus, dengue, and COVID-19. Meanwhile, re-emerging diseases are diseases that reappear in a population after they have been on a dramatic decline, such as influenza, malaria, and tuberculosis. In line with the country's priorities, the Re-emerging and Emerging Diseases RED program envisions utilizing research on the development of novel therapeutics and drug delivery systems against emerging and re-emerging diseases. This area aims to stimulate and support R&D for novel agents, specific and advanced multi-agent therapeutic modalities, and effective drug delivery systems for control and management of infectious and non-communicable diseases toward translation or utilization to the clinical setting. Epidemiological research on infectious and non-communicable diseases. This area focuses on obtaining local, regional, or national epidemiologic data for the determination of factors affecting disease incidence, transmission, and other outcomes. It also aims to utilize S&T advancements to develop and/or enhance disease mapping and surveillance system for prediction and risk management of re-emerging and emerging diseases for eventual use in the field. Preventive interventions, vaccine and other modalities against emerging and re-emerging diseases. This area focuses on improving health outcomes through R&D of preventive interventions, including but not limited to vaccination. Using advances in bioinformatics and biotechnology, the aim is to enable R&D for the prevention of disease and adverse outcomes, to forward ongoing R&D efforts in this area into translation or application, and to contribute evidence for recommendations that serve as the basis for public health policies. Early warning, biosecurity, preparedness and patient support systems or platforms against emerging and re-emerging diseases. The focus is to foster resilience in the face of re-emerging and emerging diseases through R&D. Through R&D on early warning, biosecurity and preparedness systems, measures are developed and are evaluated as regards preventing or mitigating adverse outcomes from re-emerging and emerging diseases. Recognizing the multiple dimensions of health, R&D on patient support systems focus on behavioral and psychosocial aspects of re-emerging and emerging diseases. One of the flagship projects under the RED program is the Virology and Vaccine Institute of the Philippines. The VIP is envisioned to be the premier research and development institute in the field of virology in the country. It will provide a venue for scientists, both here and abroad, to work collaboratively to study viruses of agricultural, industrial, clinical, and environmental importance. It also aims to establish strategic partnerships with the world's leading scientists, virology centers, vaccine laboratories, and other institutes. Through the VIP, we will be able to conduct innovative and pioneering research that will advance the frontiers of virology in the country. Aside from capacitating the country to respond to health crises, the VIP will also support the economy or agriculture by fighting diseases that affect animals or crops. An example would be the African swine fever (ASF), which leads to the cull of thousands of pigs and affects the livelihood of our local farmers. Through the initiatives of DOST, 8 foundation research projects were funded, 6 of which are being implemented in DOST Industrial Technology Development Institute, while the other 2 are in partnership with St. Luke's Medical Center and Research Institute for Tropical Medicine. The VIP program will also undertake policy and social science research to understand the behavioral and societal implications of these viral diseases. The target beneficiaries of the program are public health professionals, policy planners, and the community, which can use the results of the studies in general to better understand viruses of clinical, agricultural, industrial, and environmental importance. As part of the Council's aggressive pursuit in improving lives through health research, the DOST-PCHRD, being the core agency and lead of the Philippine National Health Research System, has established the RED program that aims to support the implementation of R&D projects focusing on locally relevant emerging and re-emerging infectious and non-infectious diseases using the One Health approach, with the health and clinical practice guidelines and policies of the Philippines for the benefit of the Filipino people, especially those marginalized and impoverished.
With the recent global emergence of various infectious diseases such as COVID-19 pandemic, how important is it for the country to have researchers focusing on re-emerging and emerging diseases?
Is an emerging disease. It is really important to have research focusing on emerging and re-emerging diseases, no? But when we, as I said, it must be clarified that when we say this, we are also looking into the social, human factors that bring this about. For example, we have population density, population distribution, poverty, malnutrition, travel, especially because of our OFWs. It's possible that they bring in some of these diseases from where they're coming from. In other words, we also have to look at border control and our policies regarding this, no?
With the emergence and re-emergence of several concerning diseases, how do you envision our healthcare system in 10 years' time? How would PCHRD's Re-Emerging and Emerging Diseases program contribute to this goal?
I can imagine that even now, the Department of Health must now have a collection of a vast amount of information. Not only the hard data as in numbers, but also of the soft data, describing the experiences of people on the ground, the public reaction, community reaction, no? The logistical nightmares in the actual implementation of vaccination programs, of how difficult it is to reach the very remote areas in the country, of hospitals running out of PPEs, lack of personnel, bed spaces, experiencing being misunderstood by the public, observing or experiencing the different health organizations disagreeing and confusing the public. The Department of Health may already have systematically analyzed this information and have already translated this into policies and programs as a legacy to the next administration. It will be very interesting to read this, no? But for me, bottom line is resiliency. By 10 years from now, we should have developed a public health system that is resilient, no? That is ready to face another pandemic, because there will be another pandemic. It's not will it happen, but when will it happen. So I see a public health system that is resilient, with all the elements of universal health care in place, with an integration of healthcare services at the local level, with a better surveillance system and use of surveillance data for disease prevention and control, effective risk communication, and provision of authentic health promotion, disease prevention information that engender trust and credibility. How would PCHRD contribute to this? I can see that PCHRD will have a major contribution to the science behind resiliency in public health. In other words, PCHRD shall be supporting research that include, for example, building disease models and determining the crucial pathogen, genetic, demographic, and human factors that will impact on trends, disease outcomes, and control. This also means linking surveillance activities with molecular characterization of prevalent bacterial and viral strains, identifying and monitoring antibiotic resistance, development of screening and diagnostic kits for border control, development of technology in tracing transmission of infection from animals to humans, including those from birds and arthropods. In fact, the Emerging and Emerging Disease Technical Working Group already has set science and technology goals that include the development of local and novel in technology platforms, therapeutics, preventive measures, surveillance, control, and management protocols against the emerging and emerging diseases for the benefit of the Filipino people, especially those who are marginalized and vulnerable. And congratulations to PCHRD.
Able to create a working model of transmission if we ever build the network. And the priority of the building of the network actually is dependent on what we learn from COVID. The experience from COVID will generate the future actions. So we should be able to have a network in the next 10 years that will be able to handle data collection and biosampling vis-a-vis the geographic setting that tries to build cohese the fragmented settings we have experienced in COVID. So there's a managerial component there. Without managerial component, all of us would be knowledgeable, but we would not be able to act immediately or in real time. The action will be lost. So it's very important that we are cognizant that there's an LGU-centered management. And because of that, the offhand drive will be to look at the way the local government can evolve with the local health boards. I think that's the way to get inside the local government.
The RED program is committed in continuing to adhere to the Council's goal, which is to foster healthier and more productive lives among the Filipinos through health R&D.